Hi everyone, how are you? This is Dr. Shabir Khan with watching new eye care channel. Today our topic is color blindness. This is very special topic and you must watch this video. Now I will tell you what is color blindness, its symptoms, causes and treatment. First of all, we will know about color blindness. What is color blindness? Color blindness is not a form of blindness at all, but a deficiency in the way you see color. If you are colorblind, you have difficulty distinguishing certain colors such as blue and yellow or red and green. Color blindness, or more accurately color vision deficiency, is an inherited condition that affects males more frequently than females. It means it is dominant in males rather than females. According to Prevent Blindness, an estimated 8% of males or less than 1% of females have color vision problems. Red-green color deficiency is the most common form of color blindness. Much more rarely, a person may inherit a trait that reduces the ability to see blue and yellow hues. This blue-yellow color deficiency usually affects men and women equally. Now, what are the signs and symptoms of the color blindness? Do you have difficulty telling if colors are blue and yellow or red and green? Do other people sometimes inform you that the color you think you are seeing is wrong? If so, these are primary signs that you have a color vision deficiency. Contrary to popular belief, it is rare for a colorblind person to see only in shades of gray. Most people who are considered colorblind can see colors, but certain colors appear washed out and are easily confused with other colors, depending on the type of color vision deficiency they have. If you develop color vision problems, whenever you have been able to see a full range of colors, then you definitely should visit your doctor. Sudden or gradual loss of color vision can indicate any number of underlying health problems such as cataract, etc. Now, what are the causes of color blindness? What are the causes of color blindness? Color blindness occurs when light-sensitive cells in the retina fail to respond appropriately to variations in wavelengths of light that enable people to see an array of colors. Photoreceptors in the retina are called rods and cones. Rods are more plentiful. That is, there are approximately 100 million rods in the human retina, and they are more sensitive to light, but rods are incapable of perceiving colors. The 6 to 7 million cones in the human retina are responsible for color vision, and these photoreceptors are concentrated in the central zone of retina called the macula. The center of the macula is called the fovea, and this tiny, that is 0.3 mm diameter area, contains the highest concentration of cones in the retina and is responsible for our most acute color vision. Inherited forms of color blindness often are related to deficiency in certain type of cones or outright absence of these cones. Besides differences in genetic makeup, other causes of color vision defects or loss are maybe Parkinson's disease, cataracts, certain medications, Leber's hereditary optic neuropathy, and Kallman's syndrome. Color blindness also can occur when aging process damage retinal cells and injury or damage to areas of brain where vision processing takes place also can cause color vision deficiency. Now, how do you treat color blindness? If it is gene therapy has cured color blindness in monkeys, according to the researchers at the University of Washington. While these findings in animals look promising, gene therapy would not be considered for humans until treatments are proven to be safe. Meanwhile, this is no cure for color blindness, but some coping strategies may help you function better in a color-oriented world. Most people are able to adapt to color vision deficiency without too much trouble, but some professions such as graphic design and occupations that require handling various colors of electrical wiring depending on accurate color perception. If you become aware early in life that you are colorblind, you may want to choose a career that does not require accurate color perception. Diagnosing color vision deficiency early also may prevent learning problems during school years, particularly because many learning materials rely heavily on color perception. If your child has a color deficiency, be sure to speak with his or her teacher about it so they can plan their lessons and presentation accordingly. Now, special glasses and lenses for the colorblind. What type of glasses and lenses can be used for colorblind? Some people use special lenses to enhance color perception, which are filters available in either contact lenses or eyeglass lens form. One example are colorblind glasses developed by Enchroma. The tinted lenses in Enchroma's colorblind glasses include patented light filtering technology to give people with common form of colorblindness the ability to see broad spectrum of bright colors. Most of us take for granted, according to the company. If you have color vision deficiency, see an eye doctor near you to discuss if colorblind glasses are a good choice for you. You also can learn where to work around your inability to pick out certain colors. For example, you might organize or label your clothing to avoid color clashes. Ask friends or family members who have normal vision, color vision to help with this project. Also learn to recognize certain colored items by their order rather than their color. For example, recognize that the red light is at the top of the traffic signal and green is at the bottom. Also, a variety of downloadable apps to assist with color detection have been developed for Android and Apple devices. You can get help from these devices. See an eye doctor for additional help and guidance if you have difficulty distinguishing colors, or if you suspect your child may be colorblind. Viewers, hope this video will be beneficial for you. If you like this video, kindly subscribe this channel. See you. Take care.